go? Well, good morning, Queensland, and can I say happy International Nurses Day for all of those amazing nurses who work tirelessly both across the public and the private system in Queensland and who have worked tirelessly in relation to COVID over the last 16 months. Can I report that we've had 3 new cases overnight? They are all overseas acquired and are in hotel quarantine, and no local community cases. We now have 18 current active cases that we are looking after in our hospital system, and I want to thank Queenslanders for coming out and getting tested. We've had 7,066 tests over the last 24 hours. We want people to continue to come out and get tested if they have any symptoms whatsoever. That is the one guaranteed way that we can ensure we can identify anyone in the community who may have a case of COVID. And of course we know that Victoria has reported a new community case. So from 6 p.m. last night we had police meeting people as they got off planes in Melbourne at our airports to check if any of those passengers had been to the listed venues. What we have now put in place is that anyone who arrives in Queensland before 1 a.m. tomorrow morning who has been to any of those venues are required to quarantine themselves, get tested and quarantine themselves in their home or other accommodation for 14 days from when they were at those exposure sites. From 1 a.m. tomorrow morning, anyone who arrives in Queensland from one of those sites, who have been to one of those exposure sites, will be required to go into hotel quarantine for 14 days. This is exactly the same measures we put in place last week in relation to people who had been to those venues in Sydney. We also ask that anyone who has travelled in Melbourne since the 6th of May who come down with any symptoms, no matter how mild, come forward and get tested and quarantine themselves until they get their results. And equally, because we don't know the full extent of any transmission, this person did travel from Adelaide to Melbourne. So we are also asking anyone in Queensland who has travelled from Adelaide in recent days to also just watch their health and if they have any symptoms. Of course, we know this is the instruction we're giving to all Queenslanders. Whether you have travelled interstate or not, if you have any symptoms whatsoever, please go get tested and isolate yourself till you get those results. And also continue your social distancing, your hygiene practices, and of course making sure you are checking into venues. And I thank all those venues who have now used the Queensland check-in app. It's working remarkably well. It's a very quick, easy check-in to use, and we thank all those venues for making sure that they had it up and operational on the 1st of May as we required. I'll now hand over to Dr Young to just talk a little bit more about what we are aware of in relation to Melbourne. Thank you, Dr Young.
Thank you, Minister. So this is a timely reminder about how important, if you have any symptoms at all, please come forward and get tested immediately. Don't second guess yourself, because it could be COVID. I mean, we are all very, very grateful to this gentleman in Victoria who came forward so quickly to get himself tested, which means that we only need to go back to the 6th of May to look at those exposure sites and to ask people to quarantine and isolate themselves if they've been to one of those exposure sites. So if you look on our website or you look on the Victorian website, you can see where that person's been. There may be more exposure sites as they get more information, and so it's important to keep on checking. If you've been in Melbourne since the 6th of May on or since the 6th of May, please just keep on checking our website and the Victorian website in case there are any other sites that are listed. It's really important that that's done so we can just stop any potential spread here in Queensland. We're all very good at this now. We've had multiple examples of cases that have arisen out of hotel quarantine, and we're getting very good at managing them and sorting them out very quickly. So it's important that continue. Thank you.
What do you know about this person who's infected on a flight from PNG who came into the Inala?
Right.
So that ground staff are told to leave the aircraft.
Right. Well, the good thing that we've seen here in Queensland as our response to COVID is everyone has been very, very cautious, and that has stood us well. There was no need for that to have happened because this gentleman was a fully recovered case. He was a historic case, and that was why he was given permission by the Australian Border Force to travel to Australia, because we do have in place at this point in time, Australian Border Force is responsible for protecting our international borders, and anyone who tests positive before getting on a plane is not allowed to travel until they have fully recovered, which that particular individual had. So, but I do not criticise the airport or anyone there for taking such an ultra-cautious approach. That has stood us in excellent stead. But they do not need to be concerned. This was a fully recovered case. He was not infectious. There was no risk to anyone. Having said that, we don't know that on that plane there weren't other people, because unfortunately we have seen in PNG an escalating number of cases. So there is every chance, and we're seeing them every day come through from PNG and then test positive. So there could always be a positive case in that plane. So in actual fact, we need to treat every single person on one of those flights from PNG, or indeed from anywhere from overseas, as potentially being infectious. So this particular individual did not cause any risk, but there might have been other people on that plane who did.
Public servants and other office workers have emerged or told to return to their offices. Why is it now safe for them to do so?
We don't have any community transmission in Queensland to date, and I'm very, very comfortable with the amount of testing we're doing. Over 7,000 tests in the last 24 hours, which is brilliant work. So as long as we all keep coming forward and getting tested, if we have any symptoms at all, and stay home if we've got any symptoms, then I believe we'll pick up cases quickly. And we can see that our cases are, of course, all related now to hotel quarantine. That's where our cases are. And we've got so many systems and mitigating factors in place to manage that now. So we've got staff working in those hotels who get tested every single shift. They're all vaccinated. They're wearing PPE, P2 masks. They're being checked that they understand and know how to use them. So we've got a lot of processes in place so that we can very rapidly pick up if there is any transmission, as we've seen most recently in Western Australia, in Sydney and now in Melbourne. We've got good systems. So I think absolutely it's time for us to return as much as possible to our normal lives. Now there are a few areas that I think we need to continue to delay total return, because we need to protect against mass spreading events. We all know that we can still have those until everyone is vaccinated. So that's why we need to maintain that 1 person per 2 square metres. But we know in our workplaces, we know from last year, people managed workplaces very, very well. The one remaining risk that people should be a little bit careful of in workplaces is tea rooms. People do let down their guard in tea rooms, and they do mingle at a higher rate. So if people could just be a little bit careful in tea rooms and around coffee urns and those sorts of places, but we know that people at their desks, in their meeting rooms, are really very, very low risk.
Any idea on those Melbourne flights last night how many people may have been to those exposures?
Yeah, there were none. So we got that message out, and thank you to the media. You've done a brilliant job again. So that message was out there all through Melbourne, all through our country, from media outlets about the exposure sites, and no one who had been to an exposure site got on a plane and came to Queensland. And I would be surprised if anyone got on a plane and went anywhere in the country, because people are so responsive. So yes, every plane was met, and there was no one who'd been to an exposure site.
Is there any news on music venues in Queensland?
Yep, music venues have exactly the same restrictions we have in place for other venues. Indeed, they're allowed to indoors do what I've been allowing outdoors to do for some time. So they can have 1 person per 2 square metres, or they can have 100% seated capacity. So the same as we have for outdoor stadiums. They can put as many seats as they can fit into that venue, and they can be 100% filled. They just need to be ticketed so that you know where people are seated. No different to our stadiums, etc. So exactly the same arrangements. Thank you.